Hello, I am Toshoma. Today we'll discuss about the glaucoma scale. Learning objective at the end of this session, the student will be able to define the GCS and they also have to describe the GCS score and explain about AVPU. Glaucoma scale is a neurological scale which aims to give reliable way of recording the conscious state of a person, and it is assessed against the criteria of the scale. So efficient score is between 3 to 15. If our score is 3, that indicates that the patient is in deep coma, and if it's 50, the patient is conscious. It has three components. One is eye response, second is verbal response, the third is motor response. And the eye response has 4 points. If the patient no eye opening, that is we give 1. If eye opening response to pain stimuli, we give 2. And if eye opening to speech, we give 3. And finally, if the patient can open spontaneously, we can give 4. And the verbal response have 5 points. If no verbal response, we give 1. If patient make incomprehensible sounds or moaning or noise, we can give 2. Inappropriate words or words but not current, we give it 3. If patient is confused or make disoriented conversation, 4. And if patient is oriented or normal speaking or normal conversation, we give 5. Motor response also has 6 points. If no motor response, we give 1. If patient has extensor or response, if we apply stimulus on the chest, if the patient extensor response, that is what we call that decelerate, and give 1, 2. And if patient is decorticate or flexor response, we give 3. This picture, if posturing, if we look at the first one is decorticate, and if we apply the pressure or the pain on the chest, the hand is moving towards the chest. So this is what we call the decorticate, and the hand is flexed, and the knee is flexed, and the arm is adducted here, and internal rotation of here hips, and the plantar is fixed. And here is decelerate. Here, if we apply some pain or stimuli on the chest, so our hand is totally extended, and here the finger is flexed in the pronation of arms, and the elbow is also extended, in the arms here is adducted. So this is very important during we measuring motor response. The another is if patient is withdraw from pain, that is we give 4. If localized pain, we give 5. And if patient is obeys commands or order, we give 6. When we measuring level of consciousness by using glaucoma scale, so if our score is greater than or equal to 30, that is mild injury. If it is between 9 to 12, that is moderate. If 3 to 8, that is severe injury. So this is important. The another tool which help us to measure level of consciousness is AVPU. This is acronym. A is stand for alert, and the V is stand for voice, P is for pain, and the U is responsiveness. So if patient is alert, we give 15 points. If patient respond to verbal stimuli, that is we give 13. And if patient only respond to stimuli, we give 5. If patient are responsive, we give 3. So this is important during emergency assessment to know that the level of consciousness, particularly at scene. Summary: glaucoma scale is a neurological scale which aims to give reliable way of recording the consciousness state of a person. Efficiency assessed against the criteria for the scale. So there are some limitation. If the patient is intubated, or if there is severe facial injury, or in the vein, eye swelling, it's difficult to measure. So this is important. Thank you very much.